Okay. Entering the room, checking for safety, making sure that it's safe to approach the patient, and making sure that all privacy is preserved. I'm gonna follow my 7-step of hand hygiene. Front. Hello, my name is Michael. I'm one of the nurses working here today. I'm just here to have a quick chat with you. Is it okay for me to sit down?
Yeah, of course.
Sure, thank you. Like I said, my name is Michael, but before we can actually get to some of the questions I have to ask, I just have to confirm that I'm talking to the right person. So is it okay to ask your name?
Sam Smith?
Sam Smith. Is it okay to call you Sam?
Yeah, absolutely.
That's perfect. What's the date of birth, Sam?
1st of 1st, 1987.
Perfect. And do you know an NHS number?
0004392.
That's perfect. Not many people remember that, so well done for remembering that. So Sam, I've received a referral. That referral was based on a PhD score of one of the assessments you might have done earlier. Do you remember doing that?
Yeah, I think I did it with my GP a while ago.
Okay. Did they tell you what you scored at the time?
I think it was 18?
Okay, that's perfect. So you scored 18 in your PhD score 9, and part of the support that we give you with that as well is talking therapies, or we can also give you antidepressants. I understand you're taking medication at the moment?
Yeah, I'm taking fluoxetine.
Okay, and is that helping?
I don't know.
No? Okay, so we'll explore some of the things that happened before that, just to see what the perfect therapy is for you at the moment.
Mm-hmm.
So can you please tell me in your own words, what led you to going into hospital?
Had a baby a few weeks ago. I just noticed, just started to feel really low. I was quite tearful. I was just really struggling with everything. Everything felt like it was getting on top of me. Quite tearful.
Okay. Sometimes I might have to repeat things just to make sure I'm getting things right.
Mm-hmm.
So you had a baby 4 weeks ago, you said?
Mm-hmm.
And your mood dipped just straight after that, or was it before that?
Yeah, I think it was mainly after that. I think I was struggling slightly before, but I noticed it shortly after. I had it similar with my first as well.
Okay, so you've got 2 kids?
Yeah.
Okay, so the first time, I can see from your history you've had some CBT in the past. How was that for you?
Yeah, I had 10 weeks. I think it did help. I can't remember it now.
Okay. As the improvement, did things dip straight after the CBT? Do you think it was the right therapy for you?
I think it did help at the time.
Mm-hmm.
Definitely. But yeah.
Because it's always important to know that, if you've tried the therapy, that it works.
Mm-hmm.
And if it does work, then we can always try and go with the same line of support.
Yeah.
But if that wasn't for you, then we can look at something else as well. So it's just worth knowing if CBT was the right choice for you in the past.
Yeah, no, like I said, I think it definitely helped.
Okay.
I learned some new bits from it. Like I say, I really struggle to remember it was like a year or so ago now.
So do you continue to use some of the skills from the CBT?
No.
Okay. Do you remember all the skills that you taught in the CBT?
Remember some of them.
Okay. Because it's also important to note, Sam, that you were going through a crisis at the time.
Mm-hmm.
Having a baby is quite tough. And from what you're saying, a lot of people go through those struggles with low mood, looking after themselves.
Mm-hmm.
I'm quite happy to see that, things have changed for you. You look quite great. I think at the moment we should look at the CBT again.
Mm-hmm.
I'll try and get you the same therapist just so that you can continue from the work you did the last time. And maybe some of it will be just rehashing all the things we've discussed in the past as well.
Yeah.
How does that sound?
Yeah, that sounds good. I think that'd be really helpful.
Okay, that's great. In the meantime, is there anything else I can support you with?
No, I don't think so.
Okay, that's great. So just to repeat everything we talked about the struggles you had after having a baby. It caused your mood to dip quite a bit. And we also mentioned that you've tried CBT and you did 10 weeks of CBT. You've also mentioned that it was quite helpful and you've forgotten some of the things in that.
Mm-hmm.
So it's safe to say today we're going on continuing on the CBT and maybe going through some of those skills again.
Yeah.
Sound fair?
Yeah.
Okay, happy with that. I'll make the referrals, and I'll also make sure that all the documents, you've got access to those as well, so that you're quite happy with everything that we're doing from this point forward.
Yeah. Thank you.
Are you comfortable?
Yeah. No.
And you know how to use the call bell?
Yeah, I do. Thanks.
Lovely. I'll go and do my work, and if anything at all you need, please use the call bell, and I'll make sure you're supported.
Brilliant. Thank you
It
very
was
much.
nice talking to you. Thank you so
Thank
much.